I'm Dr. Anderson with North Texas Plastic Surgery, and today we're talking about saline versus silicone implants and the effect of rupture. So it's exceptionally common for a woman to come in for consultation wanting a breast augmentation with an implant, and for her to say, I know there's different kinds of implants out there, but I don't really understand which one is the right one for me. In the most brief of terms, it's individualized, and we'll go over that at consultation. The first thing that'll happen is my nurse will talk to you about what you're looking for, size, profile, and it doesn't even have to be that specific. A lot of times it's just, I want a more modest look, I want a fuller look, I want to look fake, whatever it may be, because it's preference, and everybody has a different preference for how they want their breasts to look. So after you get done having that conversation with my nurse, I'll come in and we'll chat some more. The things that I always tell people when we're talking about saline versus silicone, first, people kind of like to know what the trend is. Overwhelmingly, people who come to me prefer a silicone implant, and one of the biggest reasons is that it has a tendency, after things settle, to feel more natural than a saline implant. A silicone implant is a little bit softer, and it will settle into that teardrop shape that can look a little more natural as well. Saline implants have a tendency to look and feel a little more firm or a little more fake compared to silicone. And again, that's a preferential thing, and we'll go over all that. In addition, I will create some 3D images of potentially both so you can determine which is the right for you. Another question that sometimes my younger patients will ask is they'll see that they read something that you can't do a silicone implant in certain age groups. So based on FDA clearances, the minimum age for a silicone implant for a patient is 22 years, and then saline doesn't really have a minimum age range. We'll talk about that and the implications. Long story short, we can do whatever you prefer, but there may be some things that we just have to discuss and make sure that everybody understands before we go down that road. Additionally, a patient may prefer a saline implant because it can be a little less expensive than a silicone implant is. And again, that's a preference thing. We'll go over the pros and cons of both. One of the biggest things people will ask about is rupture. And I don't care whether it's saline or silicone, that's always an important conversation to have so that you can be feeling like you have the most information for this product that's gonna go inside your body. So when it comes to a silicone implant, the newest generation of silicone is firm and cross-linked, or you'll even read the term gummy bear frequently. And what that means is if you cut a silicone implant in half, the gel that's inside stays the same shape. It doesn't ooze and run out like some goo or slime. So as discussed, these things are nearly impossible to rupture, but there's still a very slim chance that it does. So slim that I have to use my scalpel to do it. But as you can see, when I cut it, nothing happens. The implant doesn't go anywhere. The gel doesn't go anywhere. It's not until you manipulate, you can see the cohesivity of the gel, meaning it's stuck together, it's not going anywhere, it's not running. So even though our rupture rate of a silicone implant is really, really low, there still ultimately is the question is, if it ruptures, what happens? First of all, unlike the saline, you're not going to see a big volume difference. The breast isn't going to deflate. But what may happen is it may just feel different. Sometimes patients will say it feels just slightly softer or just feels different. But since it's not going anywhere, how do we determine this? So generally what will happen is I'll see you in clinic, we'll get an idea that we think something's going wrong, and we'll get some sort of ultrasound or MRI tests to further determine if the shell of the implant is intact. Another thing that I'll hear about from patients worried about a silicone rupture is the silicone gonna go throughout my body? So like I've mentioned, when that silicone, if it ruptures, very low rupture rate in the range of 1 to 3%, 3% at the very high side, the silicone stays together. So it's not gonna migrate to your armpit or somewhere else in your body. It just stays right there within the capsule of the implant. The opposite is true for a saline implant. If you get a hole in a saline implant, the salt water that's inside will leak out. I've actually already punctured this with a Botox needle, and what we can see is there's still really good integrity, but will result in a really slow leak over time. I'll go ahead and puncture it again and apply pressure so we can see what happens. Over time, we get this very slow leakage. Now, if we have a bigger compromise in the shell, we'll see, obviously, a greater leakage that happens. So I've actually poked this implant 3 different times with different needles. And we can see that just by itself, it's not like it exploded. It's maintaining its integrity well, but as there's pressure on it, we're gonna get more and more leakage over time. It's not until there's a large hole that we actually get something going quickly. Should be noted that is not dangerous. It's the same salt water that goes through your veins when you have an IV. So your body will just reabsorb it over time and it's no big deal. The problem with that though, is there's gonna be an obvious deflation on the side of the implant that's gone down. And if we want to be symmetric again, that mandates that we have to do another surgery to replace the implant. So frequently I'll get patients that had a previous saline implant that ruptured and we'll switch out to silicone. But like I've said, for all these things, that's just a preference issue. If you're interested in more information or want to set up a consultation, you can see our phone number and website below. If you liked this content, don't forget to comment, like, and subscribe below.